As speech pathologists, when treating voice disorders, we tend to focus on improving vocal status, which describes a patient's pain, discomfort, effort, fatigue, etc. related to voicing. Speech pathologists can use rating scales as a tool to track vocal status and how treatment is progressing. However, there's no objective acoustic measure that has been correlated with vocal status in daily voice use. It would be helpful to the field of speech pathology to develop an objective voice measure that could identify differences in vocal status during a patient's daily life, and that's what this project aimed to do. For this study, we gathered objective measures in the daily life of patients with voice disorders using an ambulatory voice monitor. This is a device that includes an accelerometer which attaches to a person's neck and estimates the vocal folds vibration. From there, we can determine various objective acoustic measures. We used a new acoustic measure in this study called the Daily Phonotrauma Index, or DPI. The DPI is a measure that was recently developed by Dr. Jared Van Stan of the MGH Voice Center and has been shown to differentiate patients with voice disorders from controls in previous studies. The DPI is an estimation of the theorized cause of phonotraumatic voice disorders. Broadly, it estimates the abruptness of vocal fold closure as well as the collision and aerodynamic forces of the vocal folds. Our study included 56 female patients who were diagnosed with voice disorders, and across these 56 patients, they wore the ambulatory voice monitor on their neck for a combined total of 99 weeks. During their day-to-day life, the women answered 3 vocal status questions on their phone, while the ambulatory voice monitor collected their DPI for every 2 minutes of voicing. We specifically wanted to look at how the DPI behaved when the patients rated stable periods of good vocal status compared to stable periods of bad vocal status ratings. That was our inclusion criteria, which required patients to have at least 1 stable good period and 1 stable bad period of the vocal status ratings based on those 3 questions they answered throughout their day-to-day life. After analyzing the 99 weeks worth of data, we found that the DPI significantly improved during the stable periods of good vocal status ratings and vice versa. Thus, the DPI does indeed estimate the accumulation of excessive vocal trauma that can cause voice disorders such as phonotraumatic vocal hyperfunction. The data also tells us that the presence of phonotrauma associated with voice disorders can significantly influence a patient's vocal status ratings. This research has implications for our ability to objectively quantify voice use that is at risk to lead to or perpetuate a voice disorder. Future work can apply the DPI to voice biofeedback.